Dr. Payal Kohli is here to answer your questions about the coronavirus. We first want to talk about our healthcare workers because a lot of them are watching. We're in a lot of waiting rooms. We're in hospitals. We want to talk about you guys, the healthcare providers. The fact that there aren't enough masks to go around scares me. It's a real problem. What happens if doctors and the nurses get sick? We've seen the Wuhan doctor who tried to warn everyone eventually died from it at 31. How are you feeling about it?
I mean, it keeps me up at night, to be honest, because in the short term, we're allowing our doctors and healthcare workers to be exposed to these patients without protective equipment. But 2 weeks from now, we're not going to have enough people to take care of the sick in the hospital.
Wow.
The CDC started out by giving us the guidance that we need to use respirators because this is, transmitted by droplets. Recently, they changed that to face masks, and they're now saying it's okay to use those in a pinch. And then if you don't have face masks, they say put on a shield or put on a bandana around your face.
Oh my God.
And that kind of guidance to me really concerns me because really the problem is the supply of the masks.
Yeah.
And we heard the White House press conference earlier today saying that there's a new supply coming in. So I'm hopeful that things will turn around. But as we're doing it right now, it is not safe for our healthcare workers. They're the highest risk population. And if we lose our troops, we cannot win this war.
They are the soldiers of this war and the invisible enemy. I just want to ask quickly, can you name the drug that is now being seen as a possible, not cure, but help with that, hydroxychloroquine?
Yeah, so it's a malaria drug. It's been around for a long time, and we just heard from the president earlier this morning that they're going to expedite FDA approval for that for this condition.
That's great.
Yesterday, a study came out looking at an HIV drug that unfortunately didn't work, but there's still one more drug in the pipeline that looks very promising. It's called remdesivir, and it's a drug that was originally made for Ebola, but may be working for this virus as well.
Thank you. Thanks for the update.
Wow.
Yeah.
All right, let's get to some questions from DBL Nation. This comes from Evan. I read that the coronavirus can stay on some surfaces for up to 3 days and in the air for up to 3 hours. Does that mean it's not safe to go on hiking trails anymore?
Evan's a hiker.
Yeah, good question, Evan. So yes, there was a study that came out that showed that if you put the particles in the air with high velocity, they can last in the air like a fog up to 3 hours. That's what we call airborne.
Wow.
But that was a very specialized circumstance under which they did that. So it's a high velocity spatter of the particles.
Is that a sneeze? Can I ask that?
No, it wasn't a sneeze. It was actually a nebulization of the particles. So a healthcare setting is really where we worry the most about the virus being airborne.
I see.
But in the community, we still think the primary mode of transmission is direct contact, like sneezing, that creates droplets. So Evan can go hiking.
Limit your nebulal particles.
What was that? Do you want to say it again? Cecilia asks, what do pregnant women need to know about the virus? Should they take extra precautions? I'm going to go a step further. I'm 38. Should I start trying? And also, if I'm having a rainbow baby or trying, a lot of you out there with IVF, moms and dads, should they stop IVF?
Yeah, so that's a tough one because with IVF, sometimes the timing of the implantation and such is really important. But the short answer is probably yes.
Wow.
If it's elective and you can stop, now is not the time to be in a healthcare system. Now is not the time to be doing something that could give you a potential complication because their healthcare resources are strapped. Pregnant women are a vulnerable group. They have to be real careful. We don't have much information about them, and this could put the baby at risk. So far, we haven't seen that, but we just don't know.
That's really honest and fair, so thank you.
Yeah. All right, let's get this one in. Tim asks, is cabin fever a real thing, and what can we do to avoid going stir-crazy in the house?
Cabin fever is real, and I'm going to ask you guys, what do you do to avoid cabin fever? Because I've been having some myself. So,
Brandon, will you get my needle point on my desk? I just did a new needle point.
I don't think we need an example.
So hobbies. I mean, I think that's a great one, Tori. Like a hobbies. I've been thinking about taking up a new hobby myself because
thank you, Brandon.
Anything that keeps your mind occupied will really help with cabin fever.
Thank you. Everyone see this? It says, make things grow. Huh? There's beading and stuff. Okay, thank you, Brandon.
Flowers.
All right.
Shauna, that went very well. Shauna says, I want to support my local businesses. We all do. And a lot of people asking this, is it safe to get carry-out food, DoorDash, stuff like that?
So we don't exactly know how much extra risk there is with somebody who might have the virus preparing your food. The risk, of course, is that they either sneeze or cough in your food or use a utensil that's contaminated and it can last on stainless steel up to 3 days.
Oh my God.
Or that they actually go to the bathroom, don't wash their hands, and then touch your food. So there could be some risk to getting takeout. We don't know how much. The safest option if you're in a high-risk group is probably to prepare your food at home.
Jess, you're all set for that.
Yeah, yeah. I mean, I have no problem with cabin fever or staying quarantined. You know,
really?
I mean, I love not being on social media. I love just being with my family. I love doing house projects. So for me, lock me up. Except we're here.
Yeah, I love not being with Jeff, but it's not going to happen. Thank you, Dr. Kohli, so much for being on the front lines, for being